Hi, this is Dr. David Gustitis from Rhythm of Life Chiropractic, and today I want to talk to those of you who have neck pain and headaches. If you're suffering from neck pain and headaches, typically that means that you have forward head posture or a combined irritation from what your neck is doing and how that affects the nerves that are coming out of the top of your spine. So those nerves that come out of the top of your spine, they branch off and they supply sensory input to your brain from this whole region, from the outside on your skull and the blood flow and the musculature of this region. So if those nerves are being pinched or irritated at the top of your neck, then that's going to contribute to having a headache. And one of the drivers of that is forward head posture. So when we're on our phones, we're on the computer, or we're slouching on a couch, that all can increase the likelihood of irritation and damage to those nerves. So as you see on this x-ray over here, this patient received one of our very detailed digital analyses of their spine. So this is a normal line of what the neck curve should look like on the green here. And the red one here is the patient. And we see that forward shift and also a kink going on right in here. And those nerves are going to be irritated, and it's going to contribute to poor motion of the spine there. So what can happen is when this gets shifted forward, there can be an increased strain and compression up here as that head goes further forward. You can do it yourself. You can feel how your head starts to feel more compressed and more irritated in this region as you drive your head forward. And if that's the case, then those nerves that branch off and wrap around on each side of your skull into your eye area, that can be a headache that's related to the nerves that branch off of here. So one of the things I encourage you to do is to watch your posture. It's a simple thing to do at home. It's not always easy, but it's a simple concept. Just work on bringing your head back over your shoulders. That's definitely something you can work on. So when you're working on your phone, try to raise it up to eye level so you're not looking down. When you're working at a computer, make sure your head is back. And then if you're watching something or sitting at a chair, make sure your bottom is slid all the way back in the chair. So those are definitely things you can incorporate right now into your life. But if you have this, chances are your spine is growing that way. It's growing into that position and it's used to it. Now, if that's the case, then your muscles and your ligaments and your nerves are in a habit pattern. And what we address is that habit pattern. Those joints can get stuck, and then you start to work around that traffic jam, okay? And that becomes an inefficient pattern, and you get used to it. And then you realize, wow, I just have these headaches all the time, or I have this neck pain all the time. So in our office, we do a consultation, we do a detailed exam, and we do a digital x-ray analysis to find out exactly where the problem is. And then we come up with a specific customized solution for you that incorporates chiropractic rehabilitation, which has strengthening exercises, stretching exercises for your spine, and the chiropractic adjustment to restore that normal habit pattern, that normal communication between your brain and your body. Okay, so if this is you, I encourage you to reach out to us today. We'd love to be of help to help you get rid of these neck pain and headaches.